So when we start practicing, it's very difficult to start seeing the first patient and know exactly how to analyze that patient, how to help them, how to approach that particular diagnostic dilemma. So for a lot of young people who are starting out in their clinical journey, it helps to start with a good solid foundation in academics. So what exactly do we mean when we say academics? We mean that it includes a theoretical knowledge about a particular subject. It includes all the literature available about a particular disease. It includes how do you analyze the literature that is available, how do you come to conclusions about the studies that have been done on a particular subject, and what further course of action you want to take, whether it is a diagnostic course or whether it is a therapeutic course. So in all of this, the word academics is a very broad term. It's to contrast with practice. So there is a concept of academics, which means knowledge for the sake of knowledge itself, and there is practice, which means knowledge that you acquire just for the sake of taking the next step in patient management. So for academics, as a broad term, we would like to focus on gathering data that is available, studying it, coming up with a certain type of algorithm or a practice statement, and then implementing it for a patient. So the importance that we attach to this entire process can help our colleagues or the juniors who are joining medicine and wanting to practice, see a future in medicine in different ways. So one is purely for a practical purpose, that I want to read something, I want to learn about it, and then I want to implement it when I actually face that challenge in the clinical work. The second is to improve your own clinical knowledge or clinical skills when you go for a particular conference or when you go for an academic workshop. So you want to acquire skills and you want to acquire knowledge before you actually even face the patient in the first place. The third important thing is that when you want to do research just for the sake of improving the knowledge base that exists, so that becomes a shift towards more academic type of medicine. So you see the clinical material that is there, you do the tests that are required, you do a particular research background search, then you come up with a research question, and then you can do a small study and you can come up with a conclusion. So that is an entirely different area that people can pursue. And finally, when in this changing era, when so much more availability of information and knowledge is there, and medical science is advancing so rapidly, this is an important area where you have to read, you have to keep yourself updated, you need to know what all are the different new diagnostic modalities, new therapies that are available, so that you can stay abreast with all the current knowledge. The other thing that is important is that there is so much pressure outside to on academicians, doctors, medical practitioners to prescribe medicines or to prescribe tests, but these things are not grounded in scientific research. So to be able to interpret the research that is there in the market or interpret the data that is available to you as an independent medical practitioner, and to see whether this drug or this therapy or this test is useful to my patient or not, you need to have your basics to be very clear so that you can implement that in your particular practice. So all of these ways are different, there are different reasons why any institute needs to have a very strong academic foundational background, so that it is not just that the patient is coming in, we are treating, we are discharging, we are also generating knowledge so that we can do a better job on the next patient. We are generating knowledge so that we can teach the others to people who may not be encountering those patients, and we are trying to create a database, or we are trying to create a background for people who are going to be reading about cases which are happening in Rajasthan, which they may not be exposed to in different parts of the country.
Thank you.
Okay, thank you.